Agora sim, muito bom dia. Estamos prontos para arrancar, para começarmos os trabalhos. Good morning, welcome everyone, and welcome for the third day of the Madeira Digital Transformation Summit. I'm pretty sure that all of you are a little bit tired from all these intensive 2 days that we had, but the truth is that we had really great days of dialogue, but yet you must agree with me that the work continues today. So we look at the rapid evolution of our digital landscape, and today's session will push our boundaries further, exploring the intersections of research, foresight, and specialized expertise. We are here to challenge existing models and propose new paths for a truly integrated digital Europe. As you already know, because I've been telling you this for the past 2 days, the keynote sessions and the panels, they are happening in this main auditorium. The workshops and paper sessions, they do happen at the breakout rooms in this venue. And also, I must remind you, don't forget to go through the paper station so you explore the latest research. Also, a quick note again, this event is being live streaming on the YouTube, so you just research for Madeira Digital Health and Well-being. Again, it's always a good opportunity to say thank you to our platinum and gold sponsors, and in this case, allow me to announce the FXS, the I2X project, LOBA, Knowledge Biz Consulting, Telerehab Project, Masai, Medusa, and Lasers for Mass. And we're going to actually start our official day with the welcoming from senior research at Uninova and a specialist in European R&D projects. Serving as general chair of this summit, ladies and gentlemen, please welcome José Ferreira.
Good morning, distinguished speakers, distinguished guests, dear colleagues, ladies and gentlemen. It is an honor and a pleasure to welcome you to this final day of I-ESA 2026, here on this beautiful island, and finally on a wonderful sunny day. As we reach the final day of the conference, we also reach a special moment, a moment to reflect on what has been achieved over these past few days. This week, we have brought together research, public leaders, innovators, practitioners, and institutions around a set of topics that are not only technical relevant, but also strategical important for our societies and our shared Europe future. Over these days, we have seen that this is not about isolated technologies, not about innovation in the abstraction. It is about how we build systems that can work together, institutions that can collaborate more effectively, and digital solutions that create real public and economic value. We have discussed many important topics, including continuity and in data ecosystems, digital health innovation, sustainable manufacturing, energy systems, circularity, and of course, interoperability frameworks that can support real deployment and long-term impact. And of course, across all these topics, we can clearly see the growing role of artificial intelligence that we can find everywhere in these days, which is becoming part of our daily lives and often without us even realizing how much is already supporting us. But an event like this is not built only through formal sessions. It is also built during coffee breaks, social dinners, and of course informal conversations between our colleagues, where we can exchange ideas, strengthen relationships, and create new friendships. Networking is essential because alone we cannot achieve the results we are hoped for. Only by working together can we go further, achieve better outcomes, and help position Europe at the forefront of innovation. One of the strong messages to emerge from this event is that the future of digital transformation will not be defined by technology alone. It will also be defined by trust, interoperability, skills, governance, and our capacity to connect knowledge to implementation. I-ESA is not simple a venue for presenting papers or sharing projects. It is a place where different sectors, disciplines, and perspectives come together. And during these days, something important has happened. Ideas have become partnerships, technical discussion have become shared directions, ambition has become capability, and most important, new connections have been created. This is important, particularly important for Madeira. For island regions, which are natural, more distant and often face great challenge in connecting with the rest of the world, digital transformation is especially important. Its impact is not abstract. It reaches health systems, public service, education, mobility, energy, water, sustainability, resilience, and our ability to attract, retain, and develop talent. In a region like Madeira, innovation must not only be intelligent, it must be useful, inclusive, and lastly, it must strengthen our capacity to respond to real needs and help us transform our geographic specificity into a strategic advantage. In that sense, many of the topics discussed here speak directly to Madeira. Realities and ambitions like digital health, interoperability system, sustainable infrastructure, circularity, energy transition, and better coordination across the sectors. And during this week, that connection has truly happened. We have brought ideas to Madeira, we helped shape conversations about the future of innovation, and brought Madeira closer to that future. In doing so, we show that Madeira relevance go well beyond the local level. Madeira is not only a beautiful place to host an international conference, it can also be a place where European priorities become tangible. Here we can clearly see why resilience matters, why continuity of data matters, why trustworthy AI matters, why sustainability cannot be separated from digitalization, and why capability building must go hand in hand with innovation. And this brings me to one of the most important ideas I would like to highlight today. I-ESA is a bridge. This year, I-ESA has been a bridge between Madeira and Europe. In that show how a conference like this can concept regional realities with European strategy. It is a bridge between research and applications, between public priorities and technology development, between institutions and innovations, between academic excellence and societal needs. This is one of the greatest value of a conference like this. It creates the condition for connection. It makes dialogues possible across boundaries that often remain separated. And by doing so, it helps Madeira engage not only as a host, but also as an active participant and contributor to the wider European conversation on digital and green transformation. That is why the importance of I-ESA extends beyond the venue and beyond these 3 days. Its importance lies in bringing together the right people around the right questions at the right time. Europe today needs forums that then celebrate innovation. It needs forums that help to support it, connect it, govern it, and sustain it. It needs space where interoperability is understood not merely as a technical requirement, but as a condition for resilience, competitiveness, public value, and of course, strategy autonomy. It is also space where sustainability is not treated as a separated agenda item, but as something that must be engaged in digital systems from the outset. And it needs space where regions, institutions, companies, and research can team together about how to move from fragmented efforts toward shared capabilities. I-ESA offers exactly that kind of space. I would also like to underline another important dimension of success, the human one. Over the past few days, this conference has not only produced value discussion, but also strengthened our community. Alongside the scientific and institutional program, and we have shared moments of hospitality, informal change, and personal connection that are equally important for building trust and collaboration. From everything we have seen, it is clear that people have not only worked hard here, they have also enjoyed being together, building relationships and experiencing Madeira. That too is part of the success of this conference. As we begin this final day, we still have an excellent program ahead. We will continue with keynote contributions and workshops that take us further into issues such as circularity, traceability, energy deployment, interoperability, water system, industrial decarbonization, urban sustainability, and broader challenge of building capabilities for sustainable digital systems. So the day ahead is not simply an ending, it is a continuation of the same essential conversation that has shaped this event and from the beginning, how to create digital systems that are intelligent, interoperable, trustworthy, sustainable, and useful to society. So to conclude, what we have seen in I-ESA 2026 is that the future will belong not simply to those who innovate faster, but to those who connect better, to those who connect systems, sectors, disciplines, institutions, and mostly important, the people. That is deeper meaning of interoperability, and that is also the deeper meaning of this conference. From Madeira, this matters because it strengthens our place within a wider network of knowledge, cooperation, and opportunity. For Europe, it matters because the challenge we face demands exactly this kind of connection, thinking, and shared capability. For all of us, it matters because it helps turn dialogue into action, expertise into collaboration, and vision into progress. Thank you, organizers. Without them, this would not be possible. To the speakers, to the participants, and to everyone who helped make this day so rich, so productive, and enjoyable, of course. It's also important. I wish you all of an excellent final day of I-ESA 26, and I already look forward to the next I-ESA in 2028 in Rome. Thank you very much and enjoy the rest of the conference.
Muito obrigada, José. Thank you so much, José. And well, as you can see here in the front, we only have three chairs, sorry. So you might count and then it would be missing someone, right? Even though I was practicing my Italian, unfortunately, Pier Paolo Limone can't be here because due to the strike of Lufthansa, so we couldn't do anything about it. Even he tried to get different airplane or different flight to get here, but it wouldn't be possible. So we say sorry for this situation that we couldn't do a different way. But in this case, my Portuguese is still good, so I would like to announce our next speaker, actually, the first keynote speaker of this morning. We will have an associated professor at ISCTE, the University Institute of Lisbon, and the former president of SPMS, so the Portugal's Digital Health Agency. He served as the member state co-chair of the European Union e-health network, and he is currently the coordinator of the European founded project XIA and I2X, focused on health interoperability. So he's already here, but please welcome a big applause for him, Henrique Martins.
Okay, thank you very much. Hi, good morning, everyone. Now with this QR code, you don't have to pay attention to me. You can just chat GPT and know about the project. But in any case, I will talk about that later. Um, it's always a pleasure to be in Madeira. It's always a pleasure to be in this particular event. And of course, an opportunity to talk about digital transformation. Let's see if this thing moves. Yes. Um, so benefiting from the extra minutes, let me try, however, not to go over too long. Um, First idea I want to convey is we all agree with these things. You see, so and that is the surprising thing, right? I mean, you talk with someone in Germany, someone in Portugal, everyone in Madeira, in Lisbon, in Porto, and any part of the world really agrees that societies are getting old. There is more technology, perhaps more knowledge. That is a very discussable and debatable topic. We all agree that any healthcare system, be it regional, national, or European, has to cater for equity, safety, effectiveness, patient-centeredness, timely, and efficient. And for politicians or managers in the room, very simple. Just keep these 6 words, and every time you make a decision, ask a very simple question: how does this decision impact on these 6 words? And if you do that, it's a high-quality decision. And we then also know, and for example, for the Portuguese population, we are talking about 20% Portuguese population on average that has never used the internet. So while we are all here talking about digital transformation, and of course that is very important, we need to realize that our clients, they're not all digital yet. And yet we do need to work hard to incorporate them. So for example, in a project I led at some point in time called Paperless NHS, in one of the hospitals where we piloted some initiatives, we had to open a counter for educating patients. Every time a patient would be prescribed with the e-prescription and he was not capable of living without paper, he would be then sent to an additional appointment of 10, 20 minutes to be taught how to access the internet, how to use a portal. Of course, it takes time, maybe not the first time, you need more time to learn. But the second difficult thing is about telehealth and meta-health. I will talk more about this. We need to integrate digital services that make us do distant care in a way that does not disrupt traditional care and trust. We need to trust our algorithms, and that means to know well how we are doing and how we are using AI. And definitely digital sovereignty, which is now becoming a big topic. And what are health systems that are digital by nature? They assume digital as a basis of work. So, for example, if we are going to schedule an appointment, we first schedule a telehealth appointment. Then the doctor or the nurse says, well, actually, in this particular case, I need to see the person. I need to touch the body of the person for these reasons. Okay, in that case, I revert teleconsultation to a physical consultation. And this is a very important thing. We digital people in the room should not be the exception but the rule. The exception is to ask someone to put themselves on a plane to come physically from Porto Santo to Funchal to an appointment that could have been done at a distance. And that actually should be justified, and there should be audit for all the doctors and nurses and other professionals that force people to wake up at 4 a.m., to travel for 3 or 4 hours, to get to an appointment where they are not touched, where there is no reason for physical interaction. Those people should be audited and they should be charged the price of the airplane and the price of the oil, because it's very expensive. And this means thinking digital first, okay? So if you can provide value for better care, if you can provide better health or improve health or move from disease to health, so you're going upwards, you're adding value, okay? And what adds value? First idea I want to convey here is an honor to my good friends in IDEA, is ideas. Concepts. Digital things start with a concept. What if all oncological patients had the opportunity to participate for 10 minutes in the last half an hour of a multidisciplinary meeting where their case is discussed before they undergo chemotherapy, radiotherapy, or surgery? Well, that's a concept. Oh, that's not possible. Oh, we discuss. But we have the concept. And with the concept, we start thinking of innovation. Oh, do they all need to join in? Does it have to be real time? Can we do it in a way that is not so disruptive of the discussions of the clinicians? Maybe they don't join the entire team discussion, but there's like a 5 minute after the discussion conversation with a specialized nurse that conveys the discussion of the clinicians and incorporates the preferences of the patient. So then we start thinking about products and services. How can we do multidisciplinary, patient-centered telehealth? And then we start to think, we start to design, we test, and we change. We change decisions and behaviors. We say, any treatment that is more than 1 million euros has to be a treatment decided by a collective of doctors, nurses, and family members. Maybe we don't apply it for all the treatments, for simple things, but we apply it for everything that will cost us a lot of money. And then we have an impact. And then we ask patients what we call EPROMs, electronic patient-reported outcome measurements. Does this make a difference? Does digital health make a difference? Are you happier? Are you less pain? If we're not measuring all the efforts that we're going to put into money in the softwares we are rebuilding here in Madeira or around the world, we don't know if all that money is producing the most important thing, health. Might be producing the jobs for a bunch of IT people, and that's good, of course, but that's not good enough. Health data, well, we used to have structured, unstructured, clinical data, non-clinical data. I would say, I always like to use this slide just to say that health data is any data that is related now or in the future, directly or indirectly, with health. And what does not seem to be health data, like for example, the way you drive your car, how often you shake with your hand on your wheel, might soon become health data in 5 years' time when you want to diagnose Parkinson's or early tremor or idiopathic tremor. You want to know, 5 years ago, were you already shaking of that hand or you were shaking of both hands? And where is the data for that? Most of us drive cars that know or could know how often we shake our hands, because they use that to know if we are grabbing the wheel or not. So if you don't have a car that alerts you to this, it's because you don't have a good car. Okay, guys? So it's time to wake up and get a good car, because that's important. Well, for now, an electric in preference. Anyway, the other thing we want for patients is that they act. They don't react, they act. They gather data, and there's a portal here, there's a mobile app. I2X, Madeira Island has promises to update the softwares and make available data for patients to integrate data. Of course, one could ask, well, should we integrate the data for the patient? And 10 years ago, I was, and many other people in Europe, working on projects where we governments, we public officials, we universities were building systems to connect data of the patient, for the patient, without the patient. So the patient was someone passive that we all were worried about, paternalistically worried about. But he was unable to do the job. He was, small or ugly or old or ignorant. That's not the case today. Of course, 20% of the patients would still struggle to use an app to aggregate data from more than one hospital, more than one country. But the more people use it, the more people learn. The more people learn, the more people get better at using it. So I believe that patients should be the ultimate data integrator, and we should allow them to be the data integrators. So we should give them data in an interoperable format They don't need to know about fire or HL7 and all those standards, but they need to know that the same way they have an MP file that can produce music in their iPod and in the iPhone and in their children's iPhone, they also have a file that they can download. The Yellow Button project with XShare and the other initiatives we are doing around Europe allows you to download the data in a machine-readable format and in a human-readable format at the same time. So I can read the information, but the computer can also read it and inject that information into the other software. So for all the Finnish people that will come to the Madeira Island this summer, and some of them will fall sick in the hospital and will have a discharge letter, that discharge letter should be given to them in an electronic format, in a machine-readable way, in an interoperable format that allows that same information to be injected in Helsinki University's hospital. So that next year, when they go to their medical appointments, what happened in Madeira is as if it had happened inside the hospital in Helsinki. And that is what European exchange format is about. This is what we're trying to do. But before we get into that, let me just alert you to one thing we are doing, which is to move from mobile health, apps, and things we have on our phones, telehealth. So in mobile health, the data goes in our pocket. In telehealth, we travel through the data. And in meta-health, metaverse, which was popular, now it's not so popular these days because it's very expensive. It's one of those technologies that had a hype and it's now in the valley of disillusion. It will come up again once the equipments are cheaper and the metaverse software is better. But for now, we are in the valley of disillusion. It's 2,000 euros to put one of these things in front of your eyes. It's super expensive. Your neck starts to have pain after half an hour. Is there evidence of clinical benefit? Yes. There's a paper, a review paper from one of my PhD students. She revised 45 papers, randomized clinical trials, on just using augmented reality and virtual reality for pain management. Anyway, we are avatarizing. Yesterday I heard about digital twins here as part of the overall project for the new hospital. And of course, I also heard someone was expecting to get a phone call from his digital twin to tell him that it was time to wake up and do some more exercise or whatever, or get a new appointment going. And that's all good. But the question really is, what will the hospital in Madeira look like? And I have a challenge because I knew Dr. Pedro would be in the room. So I've decided to choose a video I really like. And I challenge you guys to look at the similarities between the future hospital and this one. And this one is also a future hospital in an institution which I was visiting professor for 1 year, University of Korea. And one of the interesting things about this video is that it is now on the walls and on the lifts of the building. So all citizens that work and are served by this hospital, which exists, okay, the older version exists, it will be reshaped, renewed, rebuilt. All the patients can see the vision for the new hospital and for the new care. So let's see if the sound plays. So this is the new part of the new guidance. Sort of depends. Okay, so if this was a class, I would be asking you, what what emotions did you feel? So what things wow, and what not? What things you think are realistic? What things you think will take 5 years or 10 years or 20 years? But you know what? One of the things I always like when talking about the future is that there's no time limit for the future. It's the only dimension of time where there is no time. So the past mathematically ends now, and the present never exists because it's a very small fraction of time between the past and the future. And the future is always there. And sometimes people say, oh, we need to finish this in 3 years. And when, for example, I was leading the SPMES, and I was always very stressed for getting things done in 1 year, very fast, very fast. And everyone was complaining, oh, why are we going so fast? Then when COVID came, and we had e-prescription abundantly used, we had central vaccination services and a bunch of other technologies, we were much better than the Austrians, for example, and other countries to deal with a crisis that was called COVID pandemic. And the problem is we never know what is going to be our next crisis. If the next crisis is the one I wrote for the European Parliament's report in 2020, exactly in the year of the pandemic, and I was asked to write why and how is Europe using health data for the pandemic. I presume, I don't want to be pessimistic, but my assumption is that the next big crisis for European health systems will hit us with a combination of a pandemic that is not going to be acute, so the manifestations are not going to be in few days, so the infections is much worse because you don't see the persons getting sick so quick, so they infect many more people before they get sick. The second dimension is a cyber attack at the same time, like we had WannaCry virus, which in some hospitals made it. In the UK, they had problems with the hospitals for 3 weeks, not knowing who to take to the to the operating theater because all the records were wiped out. And the third crisis is what I would call a human crisis in terms of human cognition. If people start to rely too much on AI, start to rely too much on digital, they might lose the capacity to work without systems. So if you imagine now a situation of a significant health overload, with digital systems down and cognitive capacity down because people were trained and rely so much on using AI tools for clinical decision, you are down for a big crisis. Because imagine a society living a pandemic without doctors. That's what you would get, right? So imagine a scenario. There's definitely no doctors because people that have not trained, they are not doctors. Okay, this is very important. But if all our doctors are incapable of working without systems, they actually become crippled. So with this, I started this idea, and I want to convey this as a framework for thinking about the future. So if you saw that video, it's all about technology, right? But actually, this is wrong. I don't think the future hospital is only about technology. So I came up with this idea. I call it Kiwi. This has been published and written, and there's one or two articles around for a few years now. And I use this same framework for talking about the professionals. And it goes like knowledgeable, intelligent, wise, and interoperable. Okay? So you can use the same framework for thinking about professionals and hospitals or healthcare facilities. Okay? You have to remember that despite dependencies on digital being a problem, we will be working with digital professionals. We will be sitting side by side a robotic professional, physically a robotic professional, or just a robot in a software, what we call a soft robot. That is for sure the case. But that doesn't mean we do not have any mind capabilities anymore. So we also need to develop mindware. I see a lot of projects on AI. I see very few institutions having a natural intelligence initiative. 500,000 dedicated to enhancing the intelligence of the staff, measuring the intelligence of the staff, which is a taboo. In the 60s, everyone would measure intelligence. It was called IQ. Then people started saying, oh, everyone's intelligent. Now it's a taboo to say that someone is not as intelligent as another person. But actually, it boils down to like height. Not everyone has the same height. It doesn't make you less of a human being. So why would you all have the same intelligence? Of course you don't. We are not all intelligent. Well, we're not all equally intelligent. Now, some of us are really dumb. Okay, some people are dumb, and I think you've seen a few dumb people making a few stupid political decisions that are bringing us all down. But apart from the political comment, I want to say that not everyone has the same level, but that's fine. The same way as not all LMs are the same capacity. So for AI, we're very happy to measure. We measure ChatGPT against Claude and against this and against Gemini and against Llama and we measure it and say, oh, this model is more intelligent than the other one. But humans, no, let's not measure them. But worse than not measuring humans is we have stopped investing in increasing human intelligence. So the first level of the Kiwi, knowledgeability, to know what you know. So the question here, for example, for this, for Madeira is, what do we know? We know. What are the capabilities? How many people have a master, PhD? What is their thesis titles? What was the topics? What are they studying right now? How many staff members have we hired this year that are actually studying social sciences? And how many know maths? How many mathematical brains do we have in the hospital or in the primary care setting? And the same, of course, applies to those of you that are not from there in your respective countries. The second dimension is intelligence. And by intelligence, I want to emphasize this dimension of human and AI. I call it hybrid I, hybrid intelligence. It is the combination, the adequate combination of a decision making that a human does, influenced by AI, that will determine good practice into the future. Good practice of the future is the capability of a health professional to take good decisions influenced based on AI, but not ruled by AI. Third dimension, wisdom. Oh, what is wisdom? Okay, my nearest to wisdom is this little guy. Okay, You never really know if it's good or bad and what is really thinking about things, right? What is wisdom? Is the accumulated knowledge, accumulated experience, tempered with some emotion and some foresight. It is the capacity to say, you know what? The algorithms say this, the protocol says this, but there's some reason I think you're the exception, and let me try to see why and justify the exception. So ethics and trust, data security, all of these are wise things to do. So you don't do cybersecurity because of the NIST directive, Network Information Security Directive 2 from the European Commission. You do it because it is very wise to keep your data safe. Because if you have a data breach, you lose the most important thing citizens and patients can give you, their trust. And if you lose their trust, it will take you years and years to get it back. Because what is trust? It is the repetition of expected outcomes. I trust planes to land me in Lisbon. I travel maybe once a week, and I know the planes will land. Maybe they're delayed, but they will land. They will not crash on Ixte. Okay? They will not land on Ixte. They will land on the airport. So I trust it. I trust it because for many years I have been in a plane and the plane has never landed in Ixte. This is why I trust. Trust is a repetition of an expected outcome. This is how you build trust. And then, then we can talk about trustworthiness. What is trustworthiness? It is a process that would make me believe that it will land in the right spot. So for example, I know that all pilots are trained, they have simulation training, they're repeatedly trained, there's a limit of an amount of hours they can fly. All of those procedures, they don't make the plane land. They make me believe the plane will land on the right spot. That is what we call trustworthy. So the trustworthy IT system or trustworthy health system is a system that has put in place processes, people, and knowledge to produce expectable outcomes in a predictable, regular manner. Finally, interoperability. It is not about digital. It is also about digital. Interoperability is about operations that are interconnected. So the first level of interoperability we need to work, doctors, nurses, and others, they need to interop. If we don't solve the interprofessional lack of interoperability, we will never solve interoperability of data. Then, of course, we need interoperable teams, and we need, of course, if you like my voice, you can listen to Spotify 1 hour of Kiwi hospitals and also read the articles. By the way, so let me speed up because the time is flying and I only have 10 more minutes. Suddenly, so all this planning, right, strategy and so on, and I love strategy. Strategy is a sort of an anxiety-releasing exercise. You put into writing the things you think will happen, and you even put how you think they will happen, and you even write what you will do to make them happen. So it's like, wow, the future is on your hands. You will control the future. So strategy is a good thing to do if you have nothing else to do. However, suddenly things happen. And what has happened in the last 2 years? Because of ChatGPT, because of Copilot, Gemini, Claude, and all those LLMs, is that suddenly doctors, other professionals are catching up as well, find themselves with the so-called AI scribes. Suddenly, and this was really sudden, it was like in months, there is this technology that you can even download it, put it on your phone, that you record your consultation, you choose Portuguese from Portugal, and you put it in your appointment, and you talk with your patient, and at the end, you ask, could you make a summary of this appointment? And he pops up a summary of the appointment. And some companies are adding on top of this first layer, which is just voice to text and a little bit of AI, they are adding knowledge. Well, supposedly knowledge. So they're adding the capacity of the system to tell you that you forgot to ask about, for example, food habits. You were having an appointment. The first questions were about fatigue. They were about being tired and so on. So you start thinking about anemia, but you actually forgot to ask about meat intake. So the system tells you, all this conversation leads me to believe the patient has anemia. You thought it is anemia because you've ordered blood tests, but you forgot to ask about food habits, if the person is vegetarian or not, or if he avoids eating meat for some reason. And if so, if he complements with other types of food that might have enough iron to complement meat. For those of you in the room that are not clinicians and you didn't understand this metaphor, you need to study. Because I do not want technicians, IT people, to work on digital health that do not know about health. This is a personal thing, okay? So the same way as we need doctors and nurses to learn about management and IT, we need IT people to learn about health. So go on to ChatGPT, to Google and other things and learn more about health and diseases. Close my break. So what is this level? This level is of some intelligence. So these systems are coming, and this diagram is just to represent one thing that is now the reality. In today's world, literally today, there are doctors and patients that in the evening use the same software, maybe ChatGPT, maybe Claude, maybe Gemini, whatever, to ask about the diseases they were going to talk about the next day. Maybe the junior doctor was looking at something, what is the most recent treatment for, autoimmune hepatitis, because tomorrow I have a patient with that and I don't really have the time to read everything. And the patient that knows he has autoimmune hepatitis, if he's smart enough, is also going to the same software, but asking it from a patient's perspective. What are the things I should ask my doctor in the second appointment of autoimmune hepatitis diagnosis? For this reason, we submitted a project which we did not win, unfortunately, but anyway, it's still worth a try, where we would create an LLM for health and for Europe that would benefit from the questions asked by patients to give doctors and nurses insights on how patients talk about their diseases. So that then when they answer the patient, they use the same language as the patient uses to ask the questions. So I just want you to keep an eye on this triangle. And now in the last 5 minutes, I want to talk to you about I2X. So what is I2X and what are we doing that fits this ecosystem, this complicated picture that I tried to picture to you today? I2X is a project, is a EU-funded project 50-50, which means that everyone chips in with half their own resources and the rest is paid by the Commission. It bundles together companies, it bundles together universities, it bundles together SDOs, Standard Development Organizations, and it is about the intelligent use of solutions for the promotion of interoperability. So as part of the European Health Data Space, which is the new regulation in Europe that has to do with the creation of human rights on digital health, it is the first regulation in the world that creates what I call human digital health rights. For example, the right to upload your own health data to your health system, the right to download the health data, the right to demand corrections of the health data. So for example, when the new hospital here is ready, in 3 years' time, I heard, all Madeira citizens and residents should be able to upload and download their data, their health data. Now you ask me the question, what is health data? And I tell you it's all the data that matters now or in the future, directly or indirectly to their health. So who here has a watch, smartwatch, or a wristband? Arms up. See, all of you? Would you not like your data to be uploaded to it's Atrium, right? Or something like that? The software here, if you were living here? So you're collecting all the data about your health and you wanted to keep it on your phone or on your watch? No, you want to have it on the health systems, right? So that they can make some inferences and find out that you've been running and running, but now that you run, you're starting to have tachycardia after 2 kilometers, which you never had in the past because you have some small change in your cardiac electric physiological outline. And you should be called for an exam before you actually have some arrhythmia. That is the medicine of the future. Okay, it is to use health data to keep you healthy, not disease data to pay. This is the sort of the reimbursement data. So how does this work? It works because health data needs to be standardized across Europe. Different countries in different parts of Europe use different ways to record the same diseases, the same symptoms, the same things. They also use different languages, which doesn't help much. So the Commission, European Commission, together with the member states, has created this regulation, European Health Data Space, and in that regulation we have European Electronic Health Record Exchange format, which basically says that different parts of our health data should be standardized in such a way that a computer from one country can transport the information to a computer of another country and the clinical meaning does not get lost. Patient summary, so a selection of high-level health data about us, diagnosis, vaccination, medication. Yeah, don't worry, I have it on my own. But you have lab information, like imagine when you have a lab report or someone, you go and do some labs and you take that report. Imaging, the images and the image reports, the discharge reports, which I personally like very much, this domain. How are we going to do this? We're going to engage healthcare professionals. So for me, it's a very big pleasure to have been here yesterday on the workshop and here now. We need to impact at least 3 million people. So we will count on impacting at least 250,000 here in Madeira. We are engaging more than 12 member states with active demonstration sites around Europe so that we find different things about them. We are using AI tools to facilitate the work of doctors, to facilitate the work of nurses and pharmacists, so that the implementation of more technology is not more burden to the doctors and nurses and pharmacists. Okay, so that is for us very important. And then working on these different priorities. So we're bundling together natural language processing to transport data from unstructured to structured information, voice to text technology, structured data entry, and things like that. So different pieces of technology that we will use as an enabler for implementation, and then the different parts of the exchange format are going to be tested in different parts of Europe. So I want to convey this message and explain again what we should achieve after 3 years of the project. We should be able to allow all citizens that have, for example, an inpatient stay in the hospital here to go back to their respective countries with a discharge letter, for example, of what happened to them here, and that discharge letter should be able to allow that data to be injected in the softwares of their respective countries. Now, this might not happen all at once, it might not happen with all the countries, but, and this is my final minute, but it will happen. So when I started in the EU project, it was the year of 2012, we were about to finish the first cross-border pilot called EPSOS. At the time, we developed the technology, we developed the legal sort of agreement to build trust, to share patient summaries and e-prescriptions. Today, 2026, there are 16 countries where you can travel to and pick up your prescription. In the case of Portugal, in 2012, we did not even have e-prescription. So we built our national system, but already thinking of a European mindset. And what I challenge you today, and I challenge the local colleagues here today also, is that you build the future of the healthcare system conceptualizing what I call in another paper, I don't have the slide here, the global electronic health record. So if we can do this for Europe, we can surely do it for the rest of the world. Because Europe is a mini world. We have many languages, many cultures, many ways of doing things. So we have scaled up, for example, the COVID passport, the COVID PR was picked up by more than 60 countries outside Europe after it was invented in Europe. So thank you very much. And anything else we can learn together. There's courses online, there's conversations, and I'm available at any moment. Thank you very much.
Thank you, Henriques. Muito obrigada, Henriques, for this pragmatic exposition of the digital health system and to clarifying that the effort of digital transformation in healthcare should be equivalent to the patient's quality of life, definitely. So we carry on with our last keynote speaker of this morning. She's a senior faculty member of Tel Aviv University, where she leads the Technology and Society Foresight Unit. With over 20 years of research experiences, focusing on technology foresight and the future of work, ladies and gentlemen, please welcome Tal Sufin.
Okay. Good morning, everyone. I'm happy to be here. As you presented me, my main focus is actually technology foresight and technology information. For many, many years, I'm trying to understand the impact of new technologies on many, many aspects, as well as on health, and actually to see the balance between technology and human. And what I would like to do today is to switch the angle into the human and not technology. We are talking a lot about technology, this new technology, AI, robotics, all others that are entering into our life. It's not new, it's for years that we are actually facing that. But this rapid change actually creates a lot of unbalance in what we are feeling, what we are doing, and how we are coping with that. And today we will speak a little bit about the human aspect and not the technology aspect. So with that, I would like you to start with a short video, but before that I would like for you to think, what if, what you are now in 2030, how do you feel with this new aspect of technology? So let's start with this video and then we'll continue. Just to push that? No.
Have you ever wondered what healthcare could look like in the future? We're exploring a fascinating scenario today. Imagine a hospital that isn't a building, but a network. Think about that for a second. What if the hospital was a network that was with you, wherever you are? This single question unlocks the core idea we'll discuss today. It changes everything. This isn't science fiction. This idea comes from a very real place. Our healthcare systems face massive pressure, aging populations, skyrocketing costs, and strain on workers, and the limits of a system designed to react to sickness, not prevent it. Here's how we'll break it down. First, why the hospital as we know it must change, then the home as a micro-hospital. Next, we'll see it in action through a day in the life of 3 different people. Then, what it means for doctors and nurses, ethical questions, and a wrap-up. Let's get into the core concept. The hospital becomes an operating system for care, a distributed network, not just a building. And your home becomes the new center of that network. What does that mean? Let's get specific. A home as a micro-hospital is digitally connected, handling acute care, managing long-term conditions, and preventing problems. The key is continuous detailed data gathered from your everyday life. On the left, the old model, episodic visits reacting to problems. On the right, a new ball game. It's a distributed network, always on, continuously monitoring, proactive, and preventative. We're moving from a few data points from doctors' visits to streams of high fidelity data from daily life. This quote nails it. The place you're observed isn't a room, it's the data layer itself. Your health is watched moment to moment, not just when a nurse checks in. This is abstract, so let's make it real. We'll see this system in action through three people's lives. We'll meet Daniel with an acute illness, Amina managing a chronic condition, and Lena staying healthy. Daniel wakes up sick, wearables flag a fever and high heart rate. AI analyzes data and decides he can be treated for pneumonia at home. This is true admission avoidance. He has a virtual consult, a respiratory kit arrives, and his smart toilet detects dehydration risk. His care plan adjusts automatically. AI predicts risk, escalating to a virtual therapist. He gets hospital-level care safely at home. Now Amina, with chronic heart failure, her day starts with a readiness score, not a crisis. This score combines sleep quality, heart rate trends, weight, and walk stability from passive sensors. The system looks for subtle changes signaling problems, allowing her team to make adjustments, keeping her out of the hospital. Finally, Lena, healthy, her system keeps her that way, looking at genetic risk for conditions. It combines that with real-time wearable data and advanced screens for a metabolism snapshot. By layering this info, the system spots future risks like insulin resistance before symptoms appear. She gets personalized, proactive advice on diet, turning prevention into a precise data-driven action plan. If data and AI do all this, what's left for doctors and nurses? That's an important question. The system doesn't replace them, it redefines their roles. Doctors move from routine tasks. They focus on complex cases, designing AI rules and governance, using their expertise where it's needed most. Nurses become care orchestrators and health coaches, building crucial trust with patients. It's about humans focusing on judgment, empathy, and connection. This connected, data-driven future brings huge questions. This isn't a utopia. We must face ethical challenges. First and foremost, privacy. When your bathroom collects health data, where's the line between private life and clinical monitoring? How do we design a helpful, non-intrusive system? This is a fundamental challenge. Second, trust. If AI makes health decisions, you need to know it's safe and reliable. The system must be transparent. You need to understand decisions. Accountability is non-negotiable. Most importantly, equity. What about those without stable homes, internet, or digital skills? This future risks worsening health disparities. The system must be designed for everyone from the beginning. As we wrap up, how plausible is this future today? What does it mean for us now? This future is plausible because all building blocks are either here or on their way. Hospital at home programs exist. Consumer wearables are common. Smart toilets and passive sensors are coming. The AI needed to pull it together is advancing incredibly fast. This is the most important takeaway. This is an exploration of one possible future, not a prediction. The point is to ask, what if it did happen? That way, we understand choices to get there in a way that's good for everyone. This leads to our final question. Technology is coming. The real work is building human systems around that technology. How do we ensure the healthcare future we build is powerful, safe, effective, and fair for every single one of us? The future isn't something that just happens to us. It's something we all get to build. Let's build it wisely.
Okay. Go out. I just to go out for me. No, it's not. Forward. This one, but it's not. No, it's not working. Yeah, it's on YouTube. Okay. Okay, so what you just saw now, it's not created by tech company, it's not a commercial, it's not something about, that a professional was created. It was created by students, my students, in a course that I'm teaching, the future of hospitals. One of many models that the students came up with as a final output of how the future of a hospital would look like, we're taking into consideration all the aspects, the dilemmas, the concerns that we are talking about. But this is not a future scenario. It is already happening. It's happening because we see it everywhere. And when I talk about that, we can see how AI goes first before doctor has even just start having decision, AI already give him the input. So what is happening? How we are compared, how we are doing, how we cope with this situation. And we think the digital transformation is about technology, as I say, platform, AI, tools, but it's not. It's about people, it's about skills, and it's about readiness. So why transformation feels so hard on the ground? Why it's so hard to do this transformation? It's because healthcare is under a pressure. We are having actually three external factors that influence very, very hard on the healthcare system. We have the increasing of the chronic diseases on one hand, aging population, and workforce shortage. And this makes the healthcare system collapse. So it's nice to have technology, but how we are dealing with it, how we are using it wisely. In a system that breaking is in a breaking point. Why? Because staff are shortage and it's projected to be even more worse in the coming years. This overloaded of patients everywhere and the burnout. We see in that aspect how many physicians and nurses are leaving their occupations because they cannot stand it anymore, the burden, the work, the overload that they are actually facing. So healthcare systems are operating and beyond capacity today. And where leaves us? We live us in a system that technology enter into an overreach system which cannot deal with. Why? Because we are having more tools, more data, and more system in the healthcare organization. But there is no time and little slack of experimentation of learning. So we do not give them the specific time to learn, to adapt, to adjust, digest what do they need to do with this technology. And this is the main focal point that we are facing today. So what is actually missing in that aspect? It's a lack of digital skills. We know today that between 30% to 70% of health workers reported insufficient digital skills. 1 in 5 EU countries lack certified digital health education, a proper one, proper curriculum that will actually give these skills to our future generation of physicians, nurses, and so on. And continual training uneven across EU countries, so we can see that some of the countries have some dedicated program, but a lot of them are not having this program. So we are digitizing faster than we are rescaling. We have this technology, but without the proper skills to use it properly. So looking forward, we can see how AI versus human in healthcare will shape our work in the healthcare system. So today, 50% of the healthcare activity are mainly human performed. But when AI are coming into this era, we can see the 54% will become automatically. But what will be remaining still? The remaining role of the physician will be very different. It will be about how to incorporate, how to make wise decisions. So the biggest change is how work is done and not whether work exists, because it exists. And where the human add value when AI goes first? This is the big question. Jobs are changing. They are not disappearing. So we can see that we are moving from doing things to deciding, supervising, and explaining. So physicians and nurses will need to be more in the position of taking all we are getting for technology, for AI, for interpreting, understanding the language, understanding what we are having, and then have a wide decision very carefully to supervise and explain what they are seeing. And when we talk about that, we can see how the changes are becoming when we talk about this profile. So clinician becoming more supervisor on AI-driven workflows, interprets of probabilities and predictive outputs, coordinators across digital and physician setting, and final accountable decision maker. And this is a big shift from what they're doing today than what they will do in the really near future. And the biggest change is not what we do, it's how we think also, because things are changing. We talk about systems that can predict and proactive care pathways. So, patients now can do a pass from the way we are actually can detect some disease, and then we can follow and give them the support along their life. We're talking about different models of health systems. So they need to be changed in the terms of the occupation and what they are providing in the services. There will be hospitals like we know a traditional one, hospitals at home, virtual hospitals, specialized hospitals, many different models of hospital will be in the near future. And that will require a lot of change in human capacity and what they need to bring into this area. Platform-based coordination across departments. We talked a lot about this interoperability, and this interoperability is about technology, but also human, how they interact. And there are some, thinking about the future that, for example, we will not see anymore this hospital of one, divided traditional field of, for example, ICU or other disciplines. They will be interdisciplinary disciplines that will work together. This also requires different thinking, different aspects of how we are trained our future generation. And of course, continuous performance monitoring and feedback that we need to handle how this will be operates in the future. So the future workforce are less about tasks and location and more about orchestration. So it's not one main task, it's a multiple task that needs to be orchestrated when we talk about all this system and mechanism of the new future of the hospital. And when we talk about skills, we see the difference or the shift from digital literacy that we want them to know to digital fluency. And what is the difference? The difference is that when we talk about digital literacy, we want them to know about what is AI, what is big data, how to use it. But the big difference is how to use it properly, how to use it in a more sense that we will get out the most out of it. And we can see here that we must move beyond basic competence of basic literacy and functional use to data interpretation, to AI collaboration, and of course to digital leadership, which is really important in our case. And also the core skills will be changed and we need to provide them. Today, most of the studies in medicine schools are still very traditional. And that needs to be shifted and needs to be changed. And therefore, we need also to include in this curriculum and new skills like AI and data literacy, ethics and privacy and cyber. We heard a lot about what that means when we are using AI in our systems. Critical evaluation and skills, how we interpret the data we are receiving. Digital interprofessional collaboration, how we cooperate with different occupations around us, because we are not solely working. We are not only physicians or only nurses or only IT. We need to work together as a team. And of course, the workflow and the system thinking that we need to understand and give this skill as well. So these are rarely taught, as I say today, and this needs to be changed if we want a success digital transformation. And jobs are changing, as I said, but more than disappearing. So for that, we need to make sure that the roles are reconfigured, not eliminated. Clinical judgment, coordination, and human interaction remain very essential. Because routine administration and predictable tasks most affected and will be eliminated and replaced by technology. So AI augmented more than replaced. And we must remain and think that this is going to be something that we need to keep in our mind when we actually train the future of this generation. So where is the gap? What is going on today? So the healthcare work today in a very different way, as I said, AI-supported decision, digital platform, remote and hybrid care, continuous data flow, shared accountability, but the training still the same. Tool focused on learning, linear workflow, professional silos, limited supervision training, and little system thinking. So the training often focus on basic use with less attention to how the system behave, the limitation, and how they should be supervised. So this is a huge gap that needs to be bridged when we talk about the future of hospital and a success transformation. And we cannot forget about trust and responsibility. And when I act, first responsibility shift to humans. So we need to have a clear governance and also transparency and explainability. Human in the loop in the design from the first stage of the product is actually entering or development. Also, we can use today this approach of the responsible research of innovation that we are very familiar with, that each technology today needs to first go with understanding the human's needs and what we are actually, okay, and what we are actually need in order to have the most safe environment to produce it. So trust is not longer individual. It's a systematic way that we need to take care of. So what is the bottleneck? The bottleneck is not technology, as I said before, is the capability. And for that, without skills, we are hiring the risk. Why? Because if we don't know to read carefully what we are receiving, bias can be occurred, and we can have a wrong judgment and wrong treatment to a patient. Increased cognitive and coordination load, loss of situational awareness because we don't know where actually to use it properly. Increased cognitive and coordination load, as I said before, sorry for that. So for safe AI-enabled care depends on skills human, but not only on that. Technology without skills is a cost. And we know it actually from our daily life. Sometimes we are purchasing a lot of technology, but we don't know how to use it. So it stands like the elephant in the room without any use. So this is the cost we are paying if we are not having the proper skills how to use this technology for the better or the efficient it could provide us. So it's not a solid of one single hospital or organization. This is a system challenge that needs to be taken into consideration when we talk about sustainability. It's about a proper policy, infrastructure that need to be solid and to provide all this technology. And during my project, when I was actually traveling between hospitals, one of the main barriers was infrastructure. So we're having a very advanced technology, but hospitals cannot really adapt it because they don't have the capacity to use it. Even though a really stable Wi-Fi, they can actually give this opportunity to use the technology. Workforce, as I say, we need the skills, we need the proper skills in order to be able to use this technology. Education for sure, because we need this training and funding. These are all aspects if we want to have a very solid and sustained system. And this goes for the very famous rule of the 80-20. What is the 80-20? The 80-20 goes to 20% is technology, but most of that, 80% goes to capability. Because digital transformation is not a software upgrade. It is a work for evolution. And we need always to take this into consideration when we do a digital transformation. And with that, as I said before, we need to build a very stable and very solid and strong ecosystem. And this ecosystem approach will need to take into consideration and engage all the stakeholders around what we said the healthcare transformation. And it goes about hospital and clinics, health funds, government and regulation, insurance companies, tech and startups that are part of it, patient and communities, service and providers, academia, of course, and research and medical device and company, as maybe there are more. But all of them needs to be working together in order to create this success transformation. So I would like to end and ask you, are we preparing people to use them today? Are we having this system ready to implement all this technology that we are using? I leave you with this question, and I would like to end and say that the best way to predict the future is to create it. Is in our hand how to create the future, how to give these proper skills to the future generation of our medical teams all over and create a better life and quality of life to our citizens. Thank you.
In this case, thank you so much, Tol, for showing us that indeed the healthcare future is no longer a future scenario. It is actually happening. Still, there are some stones that we need to get through, and we are definitely creating the future now with this digital transformation summit. So, as you can notice, say thank you again for José. Obrigada, José. Obrigada, Henrique. Thank you, Henrique, for this morning's speakers. We're going to go up for the coffee break. We will be back on 11 a.m. So it will be a short coffee break so we can catch up on the schedule. You will have the workshop resume around the venue, as you already know. We will be back here on the auditorium at 2 p.m. so we can go up for the final keynote and also the final panel discussion. So I will encourage you for this final countdown of the conference. This way you can use your time to network, build partnerships, and engage directly with our expertise. Enjoy your break, and I'll see you here at 2:11 will be the workshops. Thank you very much. Transformation Summit, and I hope you have a lovely lunch full of energy now. If you need extra coffee, just ask for it so you can have, we can full on the this afternoon, because we're going up for our final sessions. So over the past 3 days, we have engaged in deep discussions, as you know, about the future of our digital society, from the ethics of AI to the continuity of data ecosystems. We have seen that transformation is not just about technology, but about how we build interoperability and systems that truly serve people. So to lead our final keynote of this summit, we will welcome a civil and environmental engineer with a PhD in marine engineering from the University of Finland. Since 2016, he has worked within the European Commission across various research and innovation programs, including the European Research Council Executive Agency and the Bio-Based Industries Joint Undertaking. Currently, at the European Research Executive Agency, he serves as the head of sector for the Marie Skłodowska-Curie Actions Staff Exchanges. So, ladies and gentlemen, please welcome Thomas Visikas.
Good afternoon, ladies and gentlemen, dear friends. Before I start, I would like to thank the organizers and specifically Ricardo for the excellent organization of the summit, but also the surprise party for Marie Curie last night. That was great. And of course, for the opportunity to present MSCA, Marie Skłodowska-Curie Actions, in this Digital Transformation Summit. MSCA is a program that puts the researcher in the center. And this enables actual transformation, not only digital, but in every domain of science. But before I talk about MSCA, I will talk about non-MSCA. Here you can see me some 15 years ago, somewhere in the university campus in the English countryside, carefully reconsidering my life options. As for most people, my knowledge about MSCA when I was an undergrad student was that it's a program that pays very well postdocs. My first thoughts when I joined my PhD program and I saw other MSCA doctoral candidates around me, I wondered, why is this person getting better paid than me? Why does this person has more funding for research and for laboratory equipment? Why do they have a large team beyond our research group and I don't? Did I do anything wrong? And of course, there is nothing wrong when pursuing science and pursuing your dreams. And actually, this research path gave me excellent friendships over time, gave me memories not to forget. However, let's admit also that there are different opportunities around and also that funding is scarce. That's why still after 30 years of MSCA, it remains more of the exception than the rule. MSCA, though, goes far beyond the funding. It is about excellence, about support, collaboration, inclusion, and inspiration. For this reason, when I started working in MSCA as an EU officer now, I embarked on a personal mission. Make the program even more widespread, attract people in the program who believe in the value of mobility, international, interdisciplinary, and intersectoral exposure. People who are actually eager to collaborate, people ready to support and empower the next generation of scientists, the next generation of researchers, and the next generation of entrepreneurs. When I now meet new doctoral candidates and researchers in our projects, we talk about the new world that opens for them, the opportunities, the friendships, the companionships that they are going to develop over time. But we also talk about supporting science and funding for more and better stable research careers. How MSCA can become from the exception to mainstream. How they can become ambassadors for the program and inspire others. And this is what I'm going also to ask you to do by the end of my talk today, become ambassadors of MSCA. Let's see how MSCA is linked with digital. And to answer this question, I'm going to talk to you about glue. You may find this bizarre, but glue is something that humans understood the value of very early in our history, from Neanderthals to Homo sapiens. We tried to make our weapons, our tool, with compound adhesive from animal hair to plant resins. However, the superglue as we know it today, it was only discovered in the 40s and purely by accident. 30 years ago, though, there was another glue that was discovered. This time not by accident, but by necessity and by careful design. This superglue connects researchers and organizations. It is the adhesive among careers, disciplines, and long-lasting collaborations between academia and industry. You may guess, but this glue is called MSCA. 30 years ago also, another transformation started happening with the public launch of the World Wide Web in 1993. This is the digital transformation that caused a revolution to our daily lives and had a profound interest in research as well. So this goes beyond ICT, information and communication technologies, and it is applied to all fields of science with digital methods, models, data mining, AI, that they help advance the state of the art and get new insights. Thus, digital became the second superglue among all fields and applications. These two superglues, MSCA and digital, keep transforming science and research, bringing innovations that we couldn't even imagine before. Back to our topic now about MSCA. What is MSCA? It is an EU program. I will try to put it as simple as possible. It is an EU program to fund bottom-up research and help researchers advance their careers and achieve high-impact results. It has three building blocks, as you can see: research excellence, mobility, and collaboration, interdisciplinary and cross-sectoral. This means that it funds top-quality proposals selected through a rigorous and competitive evaluation process. It also enables researchers and staff from all the world to move across countries and sectors, bringing new skills and perspectives. And of course connects, as we talked many times in this summit, academia and industry and research organizations together to turn knowledge into impact while supporting researchers with their professional growth and transferable skills. Where does MSCA stand in the funding context? This is the framework program of Horizon Europe and is the 7-year strategy of the European Union for Research and Innovation. It has a funding of almost 100 billion, which is well exceeded now with the contributions from the new associated partners, and it is recognized as the world's largest transnational research and innovation funding program. MSCA, together with ERC, belong to the first pillar, which aims at reinforcing and extending excellence of the Union's science base. MSCA will invest 6.6 billion over this period of 7 years to researchers, and our last calls are next year. But this is not all. It's not all about Horizon, it's not even all about MSCA, and I take a small pause to highlight that the EU has an overall strategy for the digital transformation. This strategy aims to make Europe fit for the digital age and connects several political priorities with organizations and funding programs. We are in the EU digital decade until 2030, and the EU is leading with policies such as AI, data, chips, Cybersecurity Act, and the famous GDPR. There are new organizations that you may have not heard of supporting this transition, such as EuroHPC, which has high-performance computing and AI factories across Europe, and I-ESA and ECCC for cybersecurity, regulations and competence, the European Digital Innovation Hubs. There are also funding mechanisms that you can explore, such as the Digital Euro program for deployment of technologies, connecting Europe facilities for infrastructure, and bottom-up programs such as MSCA and TRC. I said at the beginning that MSCA puts the researcher in the center. This happens through funding for training and career development. It allows the researcher to apply in any domain following their most promising ideas without any prescribed priorities. And of course, it promotes mobility across borders, disciplines, and sectors. The funding improves employment conditions and attracts new talent in Europe, promotes systematic collaboration with industry, SMEs, and academia. And its overarching target as a program is to have a structuring impact for organizations and programs all across Europe to make a change. The question is now, who can benefit from the program? Actually, I would say everyone in research at any point of their career. Doctoral candidates can apply for fellowships in ongoing MSCA projects. Researchers wishing to pursue a postdoc can submit their proposals in open call for proposals through our platforms. Research staff and project managers linked to R&I activities can participate in MSCA staff exchanges projects. And in terms of organizations, practically any entity from all around the world can apply. Academic institutions, including public and private higher education establishments, namely universities, non-profit research organizations, international European research organizations. Businesses and specifically SMEs are very much encouraged to participate in the program because they bring innovation and they make ideas arrive to the market. Other non-academic organizations can also participate, for example, NGOs, especially for social sciences and humanity, and they are a good part of the program as well. MSCA, as you can see in the slide, comprises a plethora of different actions. The largest in terms of budget and participation are doctoral networks, postdoctoral fellowships, and staff exchanges. Co-fund actions support co-funded projects, as the name says. MSCA and Citizens is known for the Researchers' Night that happens all across Europe. And we have Choose Europe for Science, the newest one, which tries to attract new talent in Europe with additional funding that was made available. Yesterday, you may have noticed that we cut a cake, and that cake was for the 30 years. And it's now time to take stock of what the program has achieved. My colleague Graham Wilkie gave an inspiring speech on the importance of MSCA on Tuesday morning in this very room. And I invite you also, for those who haven't done that, to join our booth and visit us, where you, apart from the promotional material, you can also watch an interview of the granddaughter of Marie Curie at the great age of 98 years old, talking about the importance of science and mobility. In the past 30 years, MSCA proudly funded over 150,000 researchers at all stages of their career. It brought new talent in Europe, with 40% of the fellows coming outside the EU. It decreased the women participation, promoted inclusive and fair recruitment of researchers. It brought together almost 10,000 businesses with research organizations. It expanded far beyond the European borders, with 130 countries participating. This is the recipe that led to the significant achievements, such as 23 Nobel Prizes and several field prizes. And this is a result of a work that happens over decades, not overnight. In the second half of my talk, I will talk more about the MSCA actions, how you can apply, and I will also give you some real-life examples. So let's start with doctoral networks, which was also my first unit that I joined in Marie Curie. What does this imply? A network implies a consortium of partners who work together towards a common research project. This project is jointly delivered via interlinked individual PhD projects that they are performed by doctoral candidates. The partners are responsible for the recruitment, the supervision, the training, the collaboration among the doctoral candidates. The funding goes mainly for the salary of the doctoral candidates and their research costs. Indicatively, and I say indicatively because the funding changes from one year to another, it is increased. The doctoral candidate today receives about 5,000 euros monthly in gross salary. To apply, a consortium should consist of at least 3 independent legal entities, each established in different European member states and associated countries. These are all, I would say, known in all horizon. And it can also include associated partners for training and for secondments. Consortia usually have strong industrial participation, and doctoral candidates experience the benefits of intersectoral mobility. Moreover, doctoral candidates who are hosted in more than one academic institutions can also receive joint or multiple PhD degrees, which is a novelty of the program. Doctoral candidates can be of any nationality. However, the only restriction is the mobility rule, which means that a researcher cannot be recruited in the place, in the country of their host organization if the researcher had activity or residence of more than 12 months in the period of 3 years prior to their recruitment. And this mobility rule, as I will explain later also, applies to postdoctoral fellowships. Moving on to what made MSCA famous, and this is the postdoctoral fellowships. Here the story changes from doctoral networks because it concerns a single researcher and a single beneficiary. So MSCA postdoctoral fellowships are for researchers with a PhD degree and a maximum of 8 years of experience in research after the award of their PhD degree. To get a PF, a postdoctoral fellowship, a researcher of any nationality should find a host, organization, and submit a research proposal in our annual call for proposals. The funding covers individual allowances for the researcher and also research costs for a period of 1 to 3 years. And indicatively, the researcher receives more than 7,000 euros monthly gross salary. From these salaries, of course, that I mentioned, there are also deductions for social security, for pension schemes, and for employers' contributions. There are 2 types of fellowships, the European and the Global Fellowship. The first is for funding research in EU member states and associated countries, while the second one allows the researcher to work in a third country and have a return phase in Europe at the end of their project. Postdoctoral researchers, similarly to doctoral candidates, they also should comply with the mobility rule that I just explained. Moving on to staff exchanges, which is the third largest action, but the most international one in MSCA, with almost 90% of the projects having third country participants, and it is formerly known as RISE. Here we go back to the concept of a DN project, because we need a consortium of partners who now exchange staff among each other. The consortia consist of universities, research organizations, businesses, many SMEs in the program, and other non-academic organizations. They need to include at least 3 organizations, and 2 of which must be in EU member states and associated countries. So in every action you see that there is a strong European component, but then we allow that the consortium can build infinitely internationally. The secondments help the staff improve their skills, advance their career, get training, and also the organizations can benefit from the knowledge transfer and the network that it is built over the duration of the project. The difference with DN and PF staff is that there is no limitation for doctoral candidates and postdoctoral researchers. Here, staff from any function can participate. It can be administrative staff, it can be project manager, it can be laboratory technicians, and they can benefit from this mobility. And this makes the program very flexible. The funding covers expenses for the secondment, the research and managerial costs, and the top-up allowance reaches 3,000 euros almost, which goes on top of the normal salary of the researcher. Thanks to their flexibility, the staff exchanges program where I work is the most popular actually for businesses. The last MSCA to describe is co-fund. It's particular because now we are talking about co-funding mechanism, and supports also programs at national level. CoFund actually provides funding for regional, national, and international programs for training and career development through co-funding mechanisms, as its name says, and it is awarded to a single beneficiary carrying out a project of at least 3 researchers. So, MSCA CoFund co-finances new or existing doctoral and postdoctoral programs and provides complementary funding to EU member states and associated countries. Now, you may wonder, why do we do this? Because we want to spread the good practices of MSCA, the fair recruitment, the good supervision, the intersectoral and interdisciplinary mobility. And through these programs also, together with all the other actions, we aim at having sustainable structuring effects and improving overall the doctoral and postdoctoral programs across Europe. Let's see now some real-life examples from our projects. But before we go there, let me share some thoughts about the breadth of MSCA projects, which actually impresses. I extracted yesterday how many projects running we have in different types of action. We have 650 doctoral networks that are currently ongoing. We fund 150 per year. We have 450 staff exchanges projects ongoing. We fund about 80 per year. 200 co-fund projects, and a staggering number of 3,500 postdoctoral projects that are currently ongoing. Not to mention all the other thousands of projects that they closed recently and they are still producing results, and the consortium keep collaborating. The question is, are they linked to digital? And to answer this question, I will tell you those that are directly linked within engineering and the ICT panel. This is about 30% of the total projects, roughly speaking. But it's not only this. The majority of projects, as I said in the beginning about the super glue, they employ digital methods, tools for their research. So the digital element is profound everywhere. Today, thus, I will try to give you just a taste of the projects that we have. And one would expect that I would go down the road of AI, cybersecurity, 6G networks, but instead I will follow a different path. I prefer to show you some of the unexpected applications in 3 different domains. The first domain is about digital infrastructure, digital industry, and climate. I will start with the project Detox, which is one of the projects in doctoral networks that makes contributions by optimizing cement production. And you may say, cement production, why do we deal with this, since cement is with us for a few hundred years? We have a big issue with cement, which is its environmental impact. Just to give you the picture, cement production is linked with 8% of the global CO2 emissions. Do you know how much is the aviation sector responsible for? 2%. So cement production is 4 times more harm for the atmosphere, for our climate, than the aviation sector altogether is. So improving the cement production has a great impact in sustainability, and it allows us in a more environmentally friendly way to continue building our infrastructure which is necessary. This consortium of Detox that aims to optimize the production of cement through reducing CO2 emissions with AI processes and modeling aims to bring industry at 4.0. It is led by a non-academic partner, by a large industry in the sector called FLSmidth in Denmark, and has 18 partners supervising 15 doctoral candidates. Needless to say that it contributes to the European Green Deal, to the circular economy strategy, and so on. I will continue with the project Portal, which, as you may guess from the first 4 letters, it's about ports. And why ports are important? Because ports actually handle 75% of EU's trade. There was a question in one of the sessions, who lives near the sea? And everybody raised their hands eventually within a few kilometers from the sea. So ports are key. We have also some geopolitical tensions now, as you may know. And this project recognizes the issues that they arise from the potential risks and threats in different ports in terms of climate, in terms of asymmetric threats, and follows an agnostic approach to improve the preparedness mechanisms. For this, they will also deploy 3 pilot projects in the port of Antwerp in Belgium, Setúbal, if I pronounce it well, in Portugal, and Vigo in Spain, to test their methodology, which is called PISCO, in real life. This is a staff exchanges project, 8 partners, 360 person months of secondment in total, and 40% of the organizations that receive secondees are non-academic. We move to the next topic, which is digital energy. And here I will start off a project that I was also the project officer. It was called, and it is still called, and doing very well actually, IntelliWind. And as you can understand, it talks about intelligence systems and in wind power generation. And the idea is that it provides autonomous wind plant applications. It aims to improve the production and allows for skills development, and also to manage to reduce the levelized cost of energy by making automated systems in maintenance of the wind energy farms. Once now we have the first problem sorted in the production of energy, we move to the second one, which is where do we store this energy? And to answer this question, we have from Staff Exchanges the project SPAR, which aims to deal with batteries. And I guess you all have one in your pocket right now. The problem is not only the batteries that we have in our pocket, but the large number of 244,000 tons of batteries that they are produced in Europe every single year. And you can see where this will go. So having safety in batteries, circular economy, working together with industry and academia will make the difference. Finally, I will talk about health, and I will start with the project Disk for All from Doctoral Networks. And I will ask you, does your back hurt? And if yes, you are not the only one. Actually, 1 in 4 adults suffer from low back pain, and is the leading reason for people to visit their doctor. So, extra strain in the health system. The Disk for All project, with 22 partners, closed in last year and produced beyond the 30 publications, 12 open databases, using numerical models for translational medicine, trying to understand the leading cause factors for lower back pain. And this modeling and open databases make the difference. The next project that you see is something that deals with something that we all have tasted at an early age, and it's the human milk. The human milk is very important because it provides distinct bioactive molecules. It improves the health of the long-term health of the infant and later the adult. But we have a problem with artificial milk that, although it tries to mimic the human milk, actually it fails in providing appropriate immune, efficient digestions, and it lacks adaptability. So this project of Staff Exchanges tries actually to build a digital twin of the human milk in order to make personalized human milk for every baby. I will briefly talk how you can get a project like this yourself if you are not already in one of them. And the good thing is that there is something to apply for all year long, every year. Today it's the last day of call for Staff Exchanges for 2026, but next time, in a year from now, you can apply for a project like this. The postdoctoral fellowship call just opened. Last time we received 17,000 applications, so we invite you to further increase the number if you can. In November, there is the deadline for doctoral networks, and for co-fund, you will need to wait for a year until next April. So the question is, where do we start? You start by having a good idea and starting building a project yourself. To do this, I will invite you to check 2 websites. One is about the MSCA website where you can find all the announcements, call for proposals, resources, guidance, seminars. It's very important. On your right is the funding and tenders portal. If you ever applied for EU funding, you know this as the one-stop shop. And there you will find also the proposal templates, the guidance, the frequently asked questions. Once you find the call that you are interested in and the MSCA action that fits best your needs, then follow the guidance and start preparing your proposal. Every year we have also events and all the support that you need to make your proposal successful. I would like to encourage you with all my strength now to get involved. And in the middle of the screen I have the word DARE. DARE is not another EU acronym, it's actually a call for action for you. Let's start clockwise. We have Euraxis portal, which is the one for finding vacancies for all EU projects. So doctoral candidates and postdoctoral researchers can find positions, doctoral candidates can find positions in co-funded doctoral networks. We have the funding and tenders portal where MSCA, PF, DN, staff exchanges, co-fund can put their applications in. And also I would invite you to check the existing projects in the Cordis database to see if there are projects actually where you can join even without applying for a new grant, but you join as an observer, as an associated partner to offer your services as well and gain from them. Finally, there is a network of national contact points, and I would kindly invite you also to use them. They are there for you, and they bridge this gap between EU calls and the national rules as well. So there, and also find people next a few steps from your office that they already have a project. They will be of great help. We are very active in social media, as you can see, on LinkedIn. We have our newsletter that you can subscribe, and we try to inform timely everyone. And I will close with a final thought, a thought from Marie Sklodowska-Curie herself, who once said, "You cannot hope to build a better world without improving the individuals." Invest in people, empower people, trust people. This is what does MSCA now for 30 years, making a paradigm shift from career precarity to stable careers, from survival stipends to fair researcher salaries and social security, from individualism and isolation to international, interdisciplinary, and intersectoral collaboration. Thank you very much for spreading the word and becoming yourselves MSCA ambassadors from now on.
Okay, then, so thank you very much, Thomas. As you can see, he's going to join us because he's going to be the moderator for our last panel discussion of this Madeira Digital Transformation Summit on the team building capabilities for sustainable systems. So this session actually shifts our focus from short-term implementation to a long-term resilience. Our experts will discuss the human and organizational capacities needed to govern and improve digital systems beyond their initial rollout. So to join Thomas on stage, I would like to invite a full professor of Artificial Intelligence and Director of the Department of Information Science and Technology at Pegaso University. He is an associate researcher at the National Research Council of Italy and the president of the Future Artificial Intelligence Research Foundation. With over 250 scientific publications, ladies and gentlemen, please welcome Giuseppe Di Pietro. To join the ones that are already on stage, a senior research associated at the Bremen Institute for Production and Logistics. His work focuses on the industrial Internet of Things and applied innovation of international research projects. So please welcome, I'll try my best on German, Moritz von Stientekron. Kind of, sehr gut. Close enough then. We will also welcome an assistant professor at the Department of Electrical Engineer at Nova School of Science and Technology, a research with the Energy Efficiency Research Group at Uninova. His expertise covers renewable energy and building efficiency. So please welcome Pedro Pereira. Finally, but not the least, we will welcome back the speaker from this morning, who is the director of the Technology and Society Foresight Unit at Tel Aviv University. With over 20 years of experience in technology, foresight, and digital skills, welcome back with a big applause for Talo Sofer. And Thomas, from now on, is you're the guide.
Thank you very much. Thank you also to our guest panelists. Good afternoon again. This panel will discuss building capabilities for sustainable digital systems. The title is fairly broad. So when I first saw it, my mind went to completely different directions, and we started discussing what do we mean about capabilities, what do we mean about sustainable. So what do we mean about capabilities? Infrastructure, software, financing and investments, international cooperation, stronger industry-academia collaboration, or investing in people skills, education, in other words, the human capital. Then what do we mean about sustainable? Long-term support, integration and interoperability, resilience of the system, and how it and its applications, how we can go beyond the many already running pilot projects and actually help them scale up and be self-sustained. All these questions we will try to answer within the next half an hour with our distinguished panelists, and believe me, we have strong capability, digital capability in this panel and in this room to answer these questions. And the good thing is that our panelists come from both, as you heard, from both academia and industry, and they cover different domains. So after this introduction, let's start with where we stand now and actually where we would like to go in the next years. And I don't dare to say in the next decades or in long-term vision of 50 years, because maybe the things that we are discussing now, and certainly in some aspects, in some technical aspects, they may become completely sound silly in 10 years from now, considering the pace that the sector is moving. For the first discussion point, let's talk about the state of play, our state of play in Europe. What are our strengths and areas of improvement in digital capabilities in Europe? Who would like to start with Giuseppe Pino?
Okay, good afternoon to everyone. As you said before, it's not very easy to define what digital capability actually means. Okay, there are different view and different, let me say, we give different importance to the different aspect regarding our knowledge and experience and so on. Europe has presenting many strengths for supporting digital capabilities, because first of all, we are very powerful and good research groups in Europe, okay, at international level. Secondly, we have an experience in cross-border cooperation, which is a very important factor for improved digital capabilities. And in my opinion, last not least, Europe also has a particular attention in some ethical and regulation aspects. Okay, all of us knows the AI Act. No, there is a framework in order to understand how AI should be applied, utilized, and also because I think that in next future AI will be the main technologies that will be applied in digital systems. So I think that there are many good points and many strengths in Europe to support digital companies. On the other hand, maybe I think that we should improve some maybe our technical aspect. For example, this consideration come from a previous experience for managing and leading a very big project in healthcare. Okay, and apart from technical interoperability, because maybe we have some standards, very well-known standards, well-applied standards, but there's a lack. There is still a lack about semantic interoperability. And I think that we have to work a lot on this.
Thank you very much, Giuseppe. I couldn't agree more, especially with the leading role that the EU has in building new legislation at the global level. Any further insight from the other panelists more on what we need to build better and what we are lagging a bit behind at the moment? Please, Tal.
When you start actually talking, it reminds me a metaphor. It's like when you have all these good ingredients to create the cook or the recipe, but you don't have the recipe. You don't have a good recipe how you connect everything. So I think in terms of strengths, we have human capital, and we have a good human capital in Europe in order to work with. We have all the teams, all the other places, men or citizens. We have technology on the other side, but to match them and to see how to use it properly, this is the glue that we need to have in order to have them more efficient, more success. And I think we are in reaching this gap that we are floating with technology, a lot of technologies around us, everywhere. It's not just health, it's education, it's health and energy. Everywhere we see our technology, even our in daily life. But the question is how we are using properly, how using wisely, and what can we do in order to actually successfully implement it. And what we are missing, I think, skills. And the proper skills that we need to actually implement from kindergarten. We don't need to, wait until our children will come into the college or their higher education to high schools, in order to start understand how to use it properly, what it is about. Know from the beginning what it is, why, how. All these questions needs to be answered by the children themselves from really beginning and till to the end. And I'm not talking about the elderly also, which we have the huge gap between the youngest and the elderly, and we need to bridge this as well. So I think we have all of it, but we need to see how we can use it really, really wisely in a cooperation. And this comes the interoperability you mentioned as well, because interoperability is maybe about technology that we would like to integrate everything, but it's also about human, about interdisciplinary, about the ecosystem that we would like to have. So from my point, this is a crucial point that we need to point and to strengthen very much in order to be successful.
Thank you very much, Tal. I see the other two speakers nodding. Pedro, would you like to add?
I'd like to put a provocative question to Tal. If you think that we as human beings, we are prepared to move as faster as technology is evolving?
No. During the history, we saw how technology is advanced and humans are always lagging behind. Sometimes because technology is not really fulfilling the needs we need. So a lot of technologies that or emerging or new technologies that's on the market are not even coming to the end because we don't need them. So I think sometimes it takes time and it's accumulating time until something are actually diffused and implemented. And for that, I think this is the symbiosis between human and technology, and this is a tango of two.
Sorry, I didn't plan to take your role.
Sorry.
No, no.
I hope I
we are
answered
here
you.
to discuss anyway. That's the important thing. Maurice, also from your perspective in product design, something that you see that we could do better collectively as Europe.
Well, I mean, I agree in the sense that we're trying to do it right, and that takes some time, which makes our life a bit more complicated maybe, but it's worth it. And we need to build the systems and the capabilities, have the capabilities to build the systems in a way that they operate in conditions which are maybe not so ideal. So I think we as researchers have to challenge us a little bit to make less assumptions and take less things for granted and broaden our system boundaries in the development a little bit. So that's something which I think would help us maybe not gain speed, but get even better solutions and better systems in development.
Thank you very much all for your first thoughts. Now I'm not going to share any breaking news with you, but we live in a turbulent world with many crises, many risks, many threats, from wars to natural disasters, which, by the way, the natural disasters are going only to intensify due to climate change. And today we have good awareness. I have a question actually whether we do have good awareness or not about our systems, their criticalities, their potential threat detection, prevention, and also if we are capable for early intervention to avoid any big blackouts, that we have some examples that we can discuss. So in other words, how are we doing in terms of preparedness in the digital infrastructure that we have? And because digital, we talked about sustainability in digital, and sustainability means resilience. So let's explore to how well we are prepared and what is also our resilience against these threats, and if our systems are ready now for what we can do better. We start with Moritz. Yes.
So first of all, I completely agree with seeing as resilience as one of the foundations of sustainability, because having an efficient and long-living and continuously improving system is not worth too much if it's not up to the task and if it's only working under ideal conditions. So we need to see that more as a design criterion, I think, in many cases. And as you rightly said, the blackout in the Iberian Peninsula last year, I think we all realized that. It has an impact not only on the disaster response side, the resilience, but also on the industrial side, because there were losses in the range of, I think, 1.6 billion euros in Spain alone. And this was only a 4-hour blackout, basically. So this is really something which is a very industrial and very real problem, and where we need to plan, I think, more for the dependencies. Because in Spain, it was not only the energy grid which went down in 5 seconds. In Spain, lost 60% of its energy capacity within 5 seconds, but also the telecommunication system of the grid providers crashed. Yeah. So if we put more emphasis on these dependencies and how the different systems link into each other, I think that is something where we can really make leaps forward in terms of reliability of ecosystems and infrastructure.
Thank you very much, Maurice.
No, I agree in the sense that actually there is an attention on managing single critical infrastructure, but there is an overall ecosystem in what's happened, for example, blackout. But blackout means that, okay, there is an emergency in hospital, or this means that without energy, some service goes down, telecommunications, so on. But we are not prepared yet for managing all the side effects of a particular accident in a critical infrastructure. And this is a very hard work to do, but it has to do.
We have a Portuguese with us on the table, so you can maybe share your experience.
I want to add something about resilience and actually sustainability, which maybe could be related, but they are different things. And I think that when you, specifically where I'm coming from Foresight, one of the things that if you want to be prepared, you need to look ahead. You need to prepare, you need to do some long-term, as we say, strategy and build scenarios. And scenarios that if something will happen, we will know how to be prepared and react, not coming into the, this event and then start thinking what is going to be happening and how we are. One of the things that we know for today, especially from COVID, that system needs to be connected or interconnected, and system is not only in one organization. It should be around, nationally, internationally. You heard that in Spain, what's happened with advertising, but in others, events in COVID as well, how you quickly prepared when systems are connected, when you can, move very flexible, agile, system can be, adjust themselves to the new situation. So this is something they need to be prepared, need to be thinking in advance. And this is also about changing our way of thinking and culture of the way we are working in a more agile way, more flexible way that can give us this flexibility to adapt in scenarios that are changing.
Maybe one addition to that. We need to also plan for failure, for graceful failure.
Wildcards.
Because if the grid collapses in 5 seconds, there's really nothing you can do immediately to make it not collapse. But you can deal with it, and you have to have systems and infrastructures which are prepared for that and can deal with it and can come back up quickly and easily.
Yeah, you're right.
Yes, we need something that we call in civil engineering hierarchical failure or control failure. At least we can manage the failure. Do we have these technologies right now, or is it just a matter of mentality in the design, or digital twins can help us better manage and take decisions timely or be warned timely for this? And I will go maybe to Pedro there, who works on renewable energies and Internet of Things. Do we have the technologies in the industry now that you see that we can deploy at least the technology, and then we can gradually improve it? And I just brought some examples from renewable energies.
I'm not sure if I'm the best person to answer to it, because sometimes I feel that I'm a little bit far from the reality. I'm just a researcher. I think we have it, but we need to combine it with some other tools. For instance, digital twins, I think it's quite good to predict what happened. We can use it to see what will happen in the case of a failure. We need to take measures to overcome this situation, and we need to prepare the citizens or the person to deal with it. Okay? Someone mentioned about blackout a few moments ago. In case of Portugal, we stayed 12 hours without electricity. It was crazy. People went to supermarkets to buy goods like crazy people. Because the system was not prepared for this kind of failures. The communication from the legal institution was not good enough in this scenario, and it was quite chaotic.
You started spoiling my next question, Pedro, because there are obviously many things happening in the research domain. We need eventually to apply some of them for the sustainability of our systems in real life. Maybe we're not there yet in every aspect, but with the advances that you see happening in research domain now, and there is a lot happening in digital transformation, how can the citizens see in the coming years some positive changes in their daily lives from new or from improved digital capabilities that we have now or will have soon.
Okay.
Giuseppe, please.
I think that citizen, this digital system, less complicated, less invasive, but more effective. Okay, there are problems for citizens um, to dialogue with the digital application in a very easy manner. Okay, and usually we say that, for example, we develop a lot of app. Okay, then are very hard to use, and we are to switch from one for another apps, and this app, in my opinion, is at present the main problem for citizens. Moreover, citizen needs a very clear information, transparent information, and this is another problem, especially not in next year, but now. The digital transformation is led by artificial intelligence. This means that we have to guarantee trustworthiness, examinability, and transparency for the final result. I think that this is the main challenge in order that the citizens trust in digital system.
Thank you, Giuseppe.
Well, I think one of the things which the citizens would like to see, if we come back to the blackout scenario, is if the pharmacies keep working. I mean, maybe the supermarkets to a degree, but the critical infrastructure, if they can really rely on the public services that they need in any situation, in an emergency especially.
So despite the challenges that the future may bring, you see some light that we will have good management of failures with the digital transformation.
Yes, definitely. I think many of the topics which we've been dealing with in our production and manufacturing use cases can be quite directly transferred to the reliability and resilience topics. So we have the right knowledge, and again, the blackout was very similar, from what I understand, to one in southeastern Europe in 2024. So we have the forensics. We just need to get the rubber on the road, basically, and make these policy changes and put the things into action. And I think NIS2 and all this in German, the Drittes Dachgesetz, they are all important steps into pushing industry to accept this responsibility. But also it should be part of the responsibility of the individual businesses. So if I am operating a business which at least sort of goes in the critical infrastructure area, then I should myself take it as a responsibility to also deal with these things and not wait for legislation to force me to.
Yes, responsibility at all levels is necessary. I will go back to one topic that we started opening, but it also connects very much with resilience, with benefits that the citizens will see. But we start from education, because education empowers and enables people, making them also more resilient. And what are the digital transformations that we should see in education to improve skills, but also personal resilience and preparedness? Shall we start with you, Tal?
Okay, I think I mentioned before, I think education is the main core when we speak about, digital transformation and how we are going to implement and use wisely and properly these technologies. Also, I think that implement all these skills in the very beginning is really important. I'm teaching, in higher education, my only graduate student, most of them are already had their PhD and they are physicians, and I'm surprised to see that they have no clue about digitalization. And when in the day-to-day life, they don't even know how to use it and what they can, do with it. So I think that our mission is in the very beginning to develop all this curriculum that needed according to the age group and start to teach them in the very beginning these skills. And these skills is not only about, the content of what is AI and what is the data analysis and other things. It's also soft skills and how to do critical thinking, problem-based learning, how to look at things in a more critical way because they are receiving a lot of, output from the ChatGPT today. They're using it, from what I need to drink or what diet should I apply, especially adolescents, which we see a lot of, not only the good things, but also the other side of the coin. So I think to be more aware of what we are receiving, what we're having in a more critical way. So all these soft skills are really relevant and really important in education when we are actually preparing this new generation. Also, one thing about what we discussed before, I think in order to prepare the citizen, it's really important to have transparency, that they know exactly what is in front of them, what is not. What is privacy? How do I protect my privacy? Because our nature is to protect our privacy, but we don't always know, especially young, what we are actually giving up instead of, keeping our privacy, our data and all that. So this is another thing that we need to raise awareness in that, new environment that we are in.
May I add something just to complement what Tol said on the education side? My students from today are totally different from 10 or 15 years ago. So we need to move from the content to the competence.
Yep.
It's no longer time to teach them what to know, but instead how to learn, how to check information, how to adapt to the new challenge that we are living nowadays. Okay.
Thank you very much. I will close with one very final question that I will ask you to respond very briefly, one line each. So we discussed a lot about resources, what we need, what we want to do. So given maximum availability of resources, funding, researchers, research groups, infrastructure, what would be the one thing that you would like to work as of tomorrow morning, 7 o'clock, and dedicate all your efforts into it? In other words, what would be your first top priority in the years to come? Who's ready to? Moritz.
I think from what we've discussed now, really the point of modeling the dependencies and the cascade effects of the different infrastructures and different topics, and not having digital twin silos, but the bridge, building this bridge is something which would be very, very interesting and relevant, I think.
We will need a good acronym for it, but I'll let you work on it.
How can we manage the introduction of the use of AI in digital transformation? I am a little bit worried about the use of AI without knowledge, without experience. And so I think that we have to do a lot of work in managing this digital transformation AI-based.
Okay, so as I'm working on the energy systems, I would like to put my coins on the reliability of the system from the generation and mostly to the end users. I think we have been put some effort on storage, on the integration of renewable energy, but it seems that they are isolated systems. We need to put it all together with the AI, but also with the human in the loop.
It's for me, of course, I'm going to education and skills, and I would like to see how we can equip our future generation with the proper skills to deal with it, whatever comes for. But they will be equipped wisely, know how to use, and be able to deal with any events that will come and be successfully, because it's not end, we are the lifelong learning is until we are finished.
Thank you very much. It's apparent that we have some strong bases in Europe for all this. We need more transparency to the citizens. We need to show the results, and also to invest in education. I think it's clear from our discussion. Thank you very much for the interesting talk, and I hope also the audience got something as food for thought for today. Thank you.
Thank you.
Thank you. I will ask you to remain on stage yet, if you don't mind, because for some ones that were yesterday at the dinner, the gala dinner, yesterday it was presented then the base paper from I-ESA and also the best workshop from the first and the second day. We are in our last day, so for now we will be presented the best workshop from the third day, the last day. And for that I will ask to come on stage the principal research at Uninova, the head of science and innovation of IDEA, Carlos Agostinho.
Okay, so I won't keep you up much longer, just to complement the award session that we started last night. So today we have carefully analyzed the workshops in the morning and not to leave anyone behind. So we have decided to award also a workshop for the day 3, and the best workshop goes to the workshop Lightweight and Flexible Interoperability Architectures, Approaches and Applications for Highly Challenging Environments, chaired by Moritz. So congratulations.
Thank you very much.
Is the title wrong?
No, it's the long title. That's why I didn't realize.
Okay,
Thank you very much.
Just for the picture, yeah. And for the next summit, you are a free entrance.
Excellent. So I'm looking forward to Rome in 28 then. Thank you.
Yes, indeed, because it happens in 2 years. Thank you so much and congratulations for that. But ladies and gentlemen, while our workshops and paper session will continue until the coffee break, so you can catch up on your digital agenda. Indeed, this remarks our final gathering as a full community. So the reflecting of these 3 past days, we have explored the complexities of interoperability, the ethical landscape of artificial intelligence, and the resilience of our data ecosystems. But beyond the technical frameworks, we have truly established here, it is a collaborative community. Allow me to address a very special thank you to our sponsors, whose support was the foundation for the summit. So F6S, the I2X project, LOBA, Knowledge Business Consulting, the Telery Hub project, Masai, Medusa, and also Lasers from Mass. Of course, allow me to address as well a big thank you for our speakers, all of them that were here from the first day, for bringing their expertise to this stage, also for the ones that rule up the workshops and the paper sessions, also for the organizing team. It was incredible to see the work you have done behind the whole scene, so we don't see that much, but they do work a lot. And also to you, the participants, especially for the ones that were here since the first day. You're strong ones. You've survived for 3 days of full of work, so well done. Allow me to also remind you that all of this information, so it was live streaming on the YouTube channel. Also, you can find out more information, pictures, anything you want on the social media and also on the website of Madeira Digital Health and Well-Being. Said this, we often speak of digital transformation in terms of softwares and systems. However, these 3 days have demonstrated that is, above all, a human endeavor, rooted in how we connect, how we build trust, and how we choose to shape a future where technology empowers every individual. As we concluded, let us carry out the spirit of innovation back to our respective countries and organizations. Let's keep this digital community thriving. And said this, Have a safe travel back to your home countries or wherever you are working. I hope you enjoyed the last day in Madeira, probably, or if you're staying for a few more days, enjoy the sunshine. Go for a dive because the sea is amazing, and go for your final workshops. And of course, I hope to see you in another opportunity as soon as we think. Thank you so much and have a good afternoon.